How does imaging help doctors find diverticular fistulas? Imagine trying to find a tiny hidden tunnel connecting your colon to another organ. That's what doctors do when they look for diverticular fistulas. These abnormal connections often develop after inflammation from diverticulitis. To locate them accurately, imaging tests are essential tools that give doctors a clear picture of what's happening inside your abdomen. One of the most common imaging methods used is the computed tomography scan, or CORT scan. It creates detailed cross-sectional images of your abdominal organs. When a doctor suspects a fistula, a CORT scan can reveal signs like inflamed diverticula, abscesses, or abnormal connections. While CORT scans are very helpful, they might not always catch every fistula. Studies show they detect about 61% of colovesical fistulas, which connect the colon to the bladder. Still, they provide critical information for diagnosis and planning treatment. Magnetic resonance imaging, or MRI, is another valuable tool. MRI uses strong magnets and radio waves to produce detailed images of soft tissues without exposing you to radiation. It's especially useful for visualizing complex fistulas because of its high soft tissue contrast. However, its ability to detect fistulas is similar to that of CORT scans, with sensitivity around 60%. This means MRI can be a good alternative, especially for patients who need to avoid radiation. In addition to scans, doctors may use procedures like cystography or cystoscopy. Cystography involves filling the bladder with contrast dye and taking X-ray images. If a fistula is present, air or dye may be seen in the bladder. Cystoscopy involves inserting a thin tube with a camera into the bladder to look for signs of a fistula directly. These procedures can confirm the diagnosis, especially when imaging results are inconclusive. Sometimes, a flexible sigmoidoscopy is performed. This allows the doctor to examine the lower part of the colon directly. While it can sometimes reveal a fistula opening, it's not the primary method for detection because it might miss fistulas that are not visible from inside the colon. Choosing the right imaging test depends on the patient's overall health and specific circumstances. For example, pregnant women or those with claustrophobia might need alternative options. It's also important to remember that no single test is perfect. In some cases, additional tests like the poppy seed test, where you swallow seeds that can help highlight a fistula, might be used to confirm the diagnosis. Overall, imaging plays a vital role in identifying diverticular fistulas. It helps doctors understand the size and location of the abnormal connection, which is crucial for deciding whether surgery or other treatments are needed. By combining different imaging techniques and procedures, healthcare providers can develop a tailored plan to manage this complication effectively. If you suspect you have a fistula or are experiencing related symptoms, always consult with a healthcare professional for personalized advice and diagnosis.